A cohort of Army medical personnel will arrive at Chris Hani Baragwanath Hospital this afternoon. They're being deployed to help the hospital healthcare workers fight a surge in COVID-19 cases. South Africa has entered a third wave of infections, with new daily cases doubling over the past 2 weeks. Patients are also reportedly being turned away from hospitals in Gauteng as the number of admissions rises. Well, for more on this story, we cross to SABC News senior reporter Chriselda, who's standing by at the Chris Hani Baragwanath Hospital for us. Chriselda, so reinforcements are on the way. Have they arrived yet?
Well, Nompu, those military medics will be deployed to several Gauteng hospitals, as you indicated correctly, including here at Chris Hani Baragwanath Hospital within the next hour. This is as the province is buckling under escalating COVID-19 infections. The number of people also dying in the province, Nompu, has also increased 80% week on week, and the third wave of hospitalization numbers have also exceeded the first and the second wave, according to experts. According to the CSIR, for example, Gauteng has recorded 62 deaths and almost 7,000 new cases per day over the past week. Now, the acting minister, you'd recall, had said that this deployment will be able to release the capacity of beds that have been held because there was no human capacity, and also to assist with mass testing as well as contact tracing. Experts say some of the province's hospitals, the patients have been forced to sit on chairs for days, while the supplemental oxygen that they have, they've had to go home with that. So it's not that there isn't enough beds as well. In Gauteng, for example, there are over 1,000 beds that were specifically built to manage COVID-19 patients. So these beds have state-of-the-art equipment, but unfortunately, Mnompo, these facilities are not being optimally used, which is really unfortunate because it's unfair on the doctors and the nurses themselves to be put under that pressure. The alternative building structures like one here at Chris Hani Baragwanath Hospital, where these medics, military medics, will be working with, which has about 500 beds. Only 100 beds of that structure are occupied at the moment, yet there are patients that are being redirected to other facilities because they are full. The Gauteng provincial government has also conceded that those structures are not being optimally used. So a good move in this instance to try and deal with the pressure on healthcare professionals, the military medics who are on their way. We understand they'll be welcomed here at the Chris Hani Baragwanath Hospital at 2 o'clock this afternoon, accompanied by the Gauteng Health MEC. That will certainly alleviate the pressure off the healthcare professionals who have for months now been working around the clock to ensure that they deal with the increase, a high number of COVID-19 infections in the province. How this will all then pan out, we'll certainly be able to monitor that over the next coming weeks into the next month, how that's been able to help with the pressure of dealing with the escalating numbers. But overall, Nompu, I think the call that is being made by professionals in this space at the moment is for residents in Gauteng to adhere to these non-pharmaceutical methods of wearing masks and sanitizing and social distancing, not to get involved in gatherings, not to gather in particular over the weekends, because Nompo, that is certainly what seems to be contributing towards the high numbers. People not prepared to change their behavior. That has now subsequently led to, you would have seen over the past week, myself and a colleague, Tsepo Pagane at SABC Radio News, have been crisscrossing several of the public and private institutions who told us that some of the wards, the COVID-19 wards, had been full while others were reaching capacity. The situation this week, totally different. We know that they're really buckling under pressure now, and this is certainly putting a lot of pressure on the healthcare professionals, as well as the fact that while there may be some beds that are there, the human capacity, which was in shortage, is certainly now going to be boosted with these military medics that are on their way. And we're expecting that to happen at about 1400 hours, in the next hour, in fact, here at the Chris Hani Baragwanath Hospital. But it's not just this hospital where these military medics will be deployed to. They'll also be deployed to other hospitals. I understand the Helen Joseph Hospital, which is just down the road from where you are broadcasting from, Nompu. So it certainly seems like these are hands on deck that will certainly be welcomed and might alleviate quite a lot of the pressure. But behavioral change, we understand from the experts that we've spoken to, is what's going to change the actual numbers, high numbers of infections that we're seeing now, where Gautengers are basically being accused of not adhering to some of the basic methods of ensuring that there isn't an escalation or an increase in the number of these infections in the province.
Chriselda, do we know why the temporary structure that was set up for, situations where we have third waves like this, do we know why they're not being used optimally?
In fact, according to one of the top vaccinologists here in South Africa, Professor Shabir Mahdi, who's often been a guest here on SABC News, he indicated to one of our colleagues, Stephen Groothuis, on SAFM this morning, one of the SABC's radio stations, that it is not per se that there is a shortage of beds in, for example, in some of the structures like here at Chris Hani Baragwanath Hospital that have been set up to assist with the high increase in numbers. It's human capacity. You actually need staff to man those facilities to treat the patients who will be sent there. That's just part of the problem. And I guess that is why these military medics are making their way to one of the hospitals, including here at the Chris Hani Baragwanath Hospital. That was one of the reasons, Nompu, that he had given. But there are many others that he also alluded to. But I think the issue of staffing, it does not help if you're going to have a high escalation in the number of COVID-19 patients. You're going to need equally a high number of healthcare professionals in order to treat those patients or the increase in patients that will be taken to those facilities. So you can set up as many structures as you want. You're going to need the human capacity. That human capacity will now come in the form of those military medics at 2 o'clock this afternoon.
Excellent. Thank you very much, Chriselda. We'll catch up with you when they arrive. Chriselda Lewis there at Chris Hani Baragwanath.